Greetings to all. In this video, we are going to see about Gardnerella vaginalis. Here, we discuss about general characteristics, pathogenicity of Gardnerella vaginalis, incubation period, virulence factor, clinical disease, laboratory diagnosis, antibiotic therapy and its treatment and its prevention. General characteristics: Gram's classification, gram-negative bacteria, shape, pleomorphic rod, motility, non-motile, size 0.5 to 1.5 μm in diameter, family Bifidobacteriaceae, capsule is absent, endospore is also absent. Respiration, facultative anaerobic, optimum temperature 37 degrees Celsius, optimum pH 6 to 6.5, habitat found in urinary tract, discovered by Hermann L. Gardner in the year 1955. Pathogenicity of Gardnerella vaginalis, disease transmission, adherence of G. vaginalis to the host epithelium, initial steps in invasion. The initial stage of infection include adherence to the host receptor site, production of cytotoxic substance specific for host cell and biofilm formation. Vaginitis produces vaginolysin, a cholesterol-dependent cytolysin for human cell, and encodes a pore-forming toxin that binds to the CD59 human complement regulatory molecule. This cytotoxin assists in the initial adherence of G. vaginalis to the host epithelial cells. G. vaginalis demonstrates three virulence factors: vaginolysin, biofilm formation by action of celluloidase activity, and cytotoxin. The other organisms may be relatively avirulent that may colonize after initiation of infection by G. vaginalis. G. vaginalis has the greatest capacity to attach to the epithelial cell in the presence of Lactobacillus crispus. Mechanism of infection: subsequent to initial adherence to the host cell, the invading bacteria multiply and may produce a biofilm community as a mean of future survival. Production of biofilm is critical to the survival of G. vaginalis in the vagina. Celluloidase, which is produced by some strain of G. vaginalis, may enhance the production of biofilm through its mucinase activity. Biofilm of G. vaginalis is tolerant to lactic acid and hydrogen peroxide produced by lactobacilli. Once this critical mass of bacteria is present, quorum sensing or bacterial potential, which is then suitable for the overgrowth of strict anaerobes, normally present in very low number. In addition, G. vaginalis is proteolytic bacterium that produces amino acid through its metabolism. Relationship between vaginalis and strict anaerobes is another mechanism whereby G. vaginalis enhances the growth of anaerobes in the vagina. This symbiotic relationship with the production of ammonia would cause more alkaline pH, which is not suitable for lactobacilli, and enhances greater multiplication or presence of G. vaginalis, and which leads to other bacterial vaginosis. Incubation period 2 to 21 days. Virulence factor of Gardnerella vaginalis. The various virulence factor of G. vaginalis are pili, microcapsule, surface hydrophobicity, adherence. Vaginolysin, phospholipase C, protease and siderospores, celluloidases and prolidases. Clinical disease caused by G. vaginalis. Bacterial vaginosis is an abnormal vaginal condition that is characterized by vaginal discharge and results from an overgrowth of atypical bacteria in the vagina. It is not a true bacterial infection but rather an imbalance of the bacteria that are normally present in the vagina. These are the anaerobic organism contributes to the pathology of bacterial vaginosis. Clinical features of bacterial vaginosis include The infection typically occurs in sexually active women. Offensive vaginal discharge, high pH more than 4.5. Pre-vaginal irritation, a thin white or grey vaginal discharge, a strong fish-like odor. Pain, itching or burning in the vagina, burning when urinating or painful urination, abdominal discomfort. Lab diagnosis of Gardnerella vaginalis, microscopic examination, gram staining, pink colored gram-negative bacteria with coccobacilli shape. Motility test, non-motile in nature. Colony morphology on culture medium, blood agar, clear beta hemolysis with diffusive edges. Biochemical test, catalase test negative, oxidase test negative, urease test negative, indole test negative, methyl red or MR test positive, Vogus Proscus VP test negative, gas production and H2S production negative, casein hydrolysis variable, phenylalanine deaminase positive, phospholipase positive, N-acetyl AD glucosamidase positive, AD glucosidase positive, gelatin hydrolysis negative. Antibiotic therapy and treatment. Gardnerella vaginalis treatment consists of 5 to 7 day regimen of antibiotic prescribed either vaginally or orally. Metronidazole, Flagyl and clindamycin, Cleocin are two common options prescribed as 150 mg, 300 mg or 500 mg tablet. Tinidazole may be prescribed as an alternative to Flagyl or Cleocin. Also, boric acid is sometimes used for recurrent infection. Prevention. Use gentle and pH balanced product around your vaginal area in the shower. Avoid things like scented tampon and vaginal deodorant. The vagina has the remarkable ability to clean and regulate itself, so you need not to clean it with any additional fluid. This will only contribute to the imbalance of your microbiome. Thank you for watching this video. Don't forget to like, share, comment and subscribe my channel.